Today's episode is brought to you by our sponsor, Gla Rehab, and features a group discussion around the impacts of brain injury on family members. This episode was facilitated by Caron Gan, a registered psychotherapist and family therapist with over 30 years of experience providing psychotherapeutic intervention to youth, adults, and families living with the effects of acquired brain injury in both public and private sectors.
Welcome, everyone, to this podcast on impact of brain injury on families. I'm Caron Gan, and I'm a registered psychotherapist and marriage and family therapist. For the past 35 years, I've been really privileged to learn from amazing families who've inspired me in both my clinical work as well as my research. And so I'm really honored to be hosting this podcast today on family impact after ABI. And it's particularly timely because today, April 5th, is National Caregivers Day. So what a way to tribute all the caregivers out there. I'm wondering if each of you can introduce yourself briefly. You have a wealth of lived expertise, so I'm really looking forward to the panel discussion. If you can tell us your first name and share a little bit about your loved one with a brain injury, that would be great. So who would like to go first? Madeline?
Yeah, I can go. So my name is Madeline, and my brother suffered from an ischemic stroke when he was 14 years old. At the time, I was in grade 12, so I was about to turn 17, I believe. He was, it happened while he was in gym class. He was running the beep test and he collapsed. And he was brought to Sick Kids where he stayed in intensive care for 3 weeks. And then following that, he was in Holland Bloorview Rehabilitation Center, both as an inpatient and then later as an outpatient for several months. So yeah, that's my lived experience.
Okay, thank you for joining us and providing the sibling voice, Madeline. Who would like to go next?
Hi, I'm Ann. I've been in this journey for 2 years. My husband had a massive ATV accident. He's 53 at the time. And then he went to Sunnybrook and found out he had, sorry to tell you, massive cancer we didn't know, and a major brain injury, but didn't find that out for a very long time. And his brain injury is the worst. And that's where we're at.
So you're fairly new in the caregiving journey, Anne, and we really look forward to learning from your experiences. Thank you for joining us. Yes. Stacey. Just take your time, Stacey. Okay.
I apologize. So I'm fairly new in the caregiver role as well. I care for my son. He was involved in a very bad car accident as a passenger in September of 2018 and has a catastrophic severe traumatic brain injury, frontal lobe, as well as multiple other injuries, but the brain injury is the most significant injury. And we work with a team of therapists, speech therapists, occupational therapists, kinesiologists, physiotherapists, and we're moving forward in his recovery, but we're very early in his recovery. And that's what brought me towards Obaya and trying to learn as much as I can and be as much support as I can for my son.
Thank you so much for joining us, Stacey. And I think for all the caregivers here, it's a challenging journey. And, even when you're in the early stages or latter stages, the lived experience is deeply felt by all. And so I commend all of you for your bravery in coming and sharing your story with everyone. Now, I'm going to start off with the first question to reflect on What were your first thoughts or feelings following your loved one's injury?
I can speak if that's all right, Karen.
Sure, Madeline.
Well, as I mentioned, I was in grade 12 at the time. This was my brother had his stroke in the fall of 2015. So about 7 years ago, approaching 7 years. I remember when it first happened, I was at a physio meeting with my mom because I used to be a competitive athlete. And she got a phone call from the school that something had happened to my brother. And I was like unaware of what had happened, but she rushed off to the hospital and the physiotherapist drove me back to school. And when I got there, people kept coming up to me and, oh, is your brother okay? He was pulled out on a stretcher. And I was like, what's going on? Because the way the principal made it sound on the phone with my mom was just that he had, fallen in gym class. And then the principal got on to the loudspeaker at the school and like announced that like someone had been brought to the hospital. And I was like, oh my gosh, this is crazy. Like no one told me that this is what was happening. So I ran up to the principal's office and they sent me down in a taxi to Sick Kids to go see my brother. I remember feeling like really, really terrified in the moment because we didn't know what was happening. And I remember he saw me and he thought that he called me Emily, which is my younger sister's name, which was just like very scary because I was like, oh my gosh, he doesn't know who I am. He wasn't able to smile with half of his mouth. And I knew right away that that was a stroke symptom, but it didn't make any sense. He was a perfectly healthy 14-year-old boy, right? So there was, in my mind, I was like, there's no reason why this should be a stroke. I remember feeling especially terrified because I kept asking the people at Sick Kids who were there caring for him in those crucial moments, is he going to be okay? Is he going to be okay? And they kept saying, like, not saying we don't have an answer, but not saying anything, like just like saying nothing, completely silent. And so that in the moment for me was really, really scary. And the initial stages, I remember not thinking long term at all. I remember not thinking it was going to be long term. Thinking it was going to be something that, he was going to be out of the hospital in 3 weeks and, that was going to be that and things were going to be fine. He also didn't lose mobility in half of his body until like 48 hours after his stroke. So especially in those early stages, I was like, oh, he's totally going to be fine. This is going to be a fast recovery. I was more just concerned about it happening again. And that was a fear that I held for a really long time, but especially in those first few days, those first few weeks, because they say, and the doctors were telling us that it could happen again and that they needed to monitor him. And I remember feeling highly, highly anxious about that in the early stages, not as much long-term, but more just, in the immediate term, making sure that, he was going to be okay for now.
So those initial reactions were one of feeling terrified and fear that it would happen again and wondering what comes down the road. So a scary time for you, Madeline. Thanks for sharing. Who else would like to go next to share their thoughts and feelings? Anne?
Well, I, in a very different situation, massive trauma. When he got discharged from Sunnybrook, he was so injured, I won't even get into it, that he was not even able to get out of the house. And his family doctor came to the home because he came home with no prescriptions and he needed medicine. And she was amazing to come into the home. And she said, well, of course he has a massive concussion based on his injuries. Now, that was the only thing. And a year later, I'm not kidding, a year later, because we were dealing with so much trauma, I'm going to the fracture clinic at Sunnybrook very regularly by ambulance because I couldn't carry him out of the house. The resident doctor said, well, of course he has a TBI or an ABI or a year later. So nobody discussed it with me. It was a pandemic. I wasn't allowed to go there. No doctor phoned me. Nobody told me. So it was crazy. And now, another year 2 years post accident, it's massive. And I'm not kidding. He has an MRI booked for May, and he hasn't had one yet because his brain injuries are so bad, he won't even be able to do it because of the sound. So that's not going to happen. I know it won't happen. So it's pretty serious.
And it sounds like the information that you needed in the early stages were not there for you, and you're finding out much later.
There was just so much trauma and injury and other issues that it wasn't a priority. The recovery, all the services, like Stacey said, a hospital ward and OT, physio, you can't even imagine what's coming to my home. It was a hospital ward. And so it wasn't a priority. It was recovery priority first, and getting his medication first, and trying to get him comfortable first. And the brain injury was so later. Yeah.
Thank you for sharing that, Anne. Stacey, are you comfortable sharing your thoughts and feelings?
Yeah, so Jake's collision was, as I said, he was a passenger, and he took the brunt of the impact in the collision. They were T-boned. And I got a call from I apologize. We're just going through. Jake speaks to a neuropsychologist once a week, and we took a bunch of pictures and videos when Jake was in the hospital, and I'm just in the process of compiling those onto a hard drive for him to see, because they felt it would. So it's taken me back right to that time. So I'm going to say that's why I'm so emotional right now, is because I'm right back in ICU. I'm right back in the ER room. And anyway, I got a call from one of Jake's friends saying that he had been in an accident and that I had to get to the hospital. And so I made some calls to our local police agency to try to find out what was going on. And of course, dispatch can't give any information. And then I was starting to get many more calls and text messages saying that I needed to get to the hospital. So I got to the hospital right away, and we couldn't see Jake because they were working on him, and he immediately went into. It's funny, but the vascular surgeon, Jake's aorta was torn, so he had to go into surgery right away. And I remember signing because he needed a blood transfusion because he had lost so much blood. Signing it with this big, thick black Sharpie marker. And I thought, like, you don't normally would sign a consent form with a big marker, but that's all the doctor had on his in his jacket. So Jake wasn't conscious. He went into surgery for multiple hours, and we actually didn't get to see Jake for about 5.5 hours after being at the hospital. And when we went in to see him in ICU, he had a trach and what seemed to be like 100 tubes plugged into him. He wasn't breathing on his own. His lungs were collapsed. He had severe damage to his liver and kidneys. His pelvic was completely crushed. He was in a self-induced coma for several weeks, so we didn't know the extent of the brain injury. And then his collision was on the 14th of September, and 4 days later he had pelvic surgery. So they pinned and plated him back together. And when they were weaning him off the fentanyl pain medication, he suffered a severe seizure, which paralyzed the right side of his body. And we knew that it had paralyzed the right side of his body because he had injury, which they said was conducive to brain injury movement. Like his leg was constantly going up and down, and no control of his arms, no control of any part of his body functions. So he was in a self-induced coma for several weeks, and then when he did come around, it was his eyes would open, but there was nothing there. So over time, we eventually graduated from ICU, and then we went to Peds ICU because he was a pediatric patient, and he turned 17. He turned 17 just a couple of days after his collision, and we didn't realize the extent of his brain injury until after, he came around and they tried to give him medication to try to make him more alert, to try to wake him up. And he wasn't responding to any of that. So it wasn't until we were in the hospital for some time that we knew the extent and the severity of his brain injury. Not something you'd ever want to see. My boy was an honor student, and he was a great athlete. Had lots of friends. And the boy that he was with, I'm thankful that he wasn't a close friend. I'm not even sure why Jake was with him in the car, but anyway, his injuries were very minor. Treated that same day and left the hospital with just a small Band-Aid, and we were in the hospital for 5.5 months with Jake.
So Stacey, clearly this was a very, and continues to be very traumatic for you, especially having to go back to that time and retell that story. So thank you very much for sharing that. Now, I'm wondering, what was the most significant impact to your family following your loved one's injury?
I guess I can talk about our experience in the immediate, like right after my brother Aaron got sick. My parents, obviously, their full, undivided attention was on him. My sister stayed at her best friend's house for like several weeks following the incident. Also because she had a cold at the time and they didn't want her in the hospital, so she couldn't actually see my brother until she had recovered. And then after that, she was quite young. She's 7 years younger than me, so she was like 9 at the time. Yeah, 9 at the time. And so they didn't want her to see him, in the state that he was in. And then for me, I was in the process of applying to universities, and I was also a competitive athlete. And that was my final season as a competitive athlete before I was going away to university. And that was kind of thrown out the window as well, which was challenging for me at the time. But then at the same time, I'd feel such immense guilt every time I felt bad, like every time I was feeling annoyed or feeling upset that I couldn't do the things that, I'd planned to do in my final year of high school. My parents couldn't take me to any university tours. They couldn't come to any of my skating competitions. I was a figure skater. And I kind of just had to start doing more things on my own and relying on our community. In the long run, because it has been several years now, it still does impact my family for sure. I think that, it's been very, very challenging on my parents, and we're not the way we were before, for sure. In terms of like specific ways, I guess that it continues to impact my family. I mean, my brother, he's come such a long way, and we're all like so exceptionally proud of him. He's, graduating from engineering school next year, which is a massive accomplishment. He, is able to ski again. He was a very avid skier before his stroke, and it took him several years to get back on that mountain. The doctors of sick kids told him he never would, and he did it. So he's come a very long way. But it was very traumatic what he went through. And I think we all need to be very sensitive to that. Just in his continuing behaviors, and the way he responds to situations. So yeah, I guess it's still, he still is a priority in the family. And that's just the reality of having a sibling with a brain injury.
So the impact on the family was felt very much at the beginning, but it continues to be felt even years after.
I think that's something like at the time, I was thinking very short term, right? I think we all were, but it's continued. Like it'll always be a part of us now. It's not ever, our family will never be the way it was before this, before my brother had his stroke.
Mm-hmm. Thank you, Madeline. Who would like to go next? Or would you like to add anything?
I feel like we're going in order for every question, so it seems simple.
Okay.
Keep up with that order.
Sure.
At the time of my husband's accident, I was living with my daughter, who's 31, and she's been living with us full time. So my gut reaction when I read the questions about what we would discuss today, my gut reaction of massive, most significant impact, I would have to say, is sound sensitivity. He was deaf before the accident, and now he's hypersensitive to sound. And that affects every single step you take in the house, every chore you do, every movement. The two of us, my daughter and I, are walking around on eggshells every single second. It's difficult to get anything done or turn on the dishwasher or do a load of laundry or make a meal. Everything is worked around. Does he have his head noise canceling headphones on? Does he have earplugs on? Is he outside? And the second he's got those things on or he's doing those things, we're running around like chickens trying to get all these things done because we don't want to bother him, because he's very, very upset. My daughter's reaction when I asked her that question, she said the massive change in my relationship with my husband, which is, of course, massively true. But I find, of course, that's never going to change. That's where we're at. And it seems to be getting worse. It doesn't seem to be getting better. And maybe because he's on a lot of medication and he's in a lot of pain, that it's more hypersensitive even now. Sorry, but that's the truth.
It's often been said that every brain injury is different. You've seen one brain injury, you've seen one brain injury. So, and, in your situation with your husband, the hypersensitivity to sound is quite profound. And that's had significant impact for all of you.
It does. And also light, massive issue with light. He's wearing sunglasses and binders along the side here, and he's wearing them in the house 24 hours a day.
Mm-hmm. Thank you, Anne.
Okay.
Stacey, if you'd like to just share whatever you're comfortable sharing around impact to your family, that would be great.
Yeah, so I think initially the most significant impact was to Jake's brother, who had just left the province to go to Nova Scotia for his first year of university. So the collision happened just, a couple of days after he arrived and got settled into residence. And so his first semester was severely impacted as a result of the collision. It's impacted us all in very, very different ways. It's impacted Jake the most. And I say to him that he's like the new improved Jake, because he'll never be the Jake that he was before. But yeah, it's significantly impacted our entire family. Our work, our daily routines. Our therapists have become our extended family and the most supportive because they understand Jake's injury. And it's hard because even close family and friends, they try, they're very supportive, but they don't understand the extent of his injury. So, and I definitely get the light sensitivity. Jake actually has glasses. They're called FL41 glasses to help reduce the glare, because he does have sensitivity to fluorescent lights and the sunlight. And we definitely suffer from the sound impact as well.
And clearly there's been a ripple effect for all of you after your loved one's injury. It impacts the parents, it impacts the sibling relationships, the spouses, and so the family impact is huge. It's a family affair for all of you. Now, what were you least prepared for, and how can existing healthcare systems better prepare families for life after brain injury?
I think I was least prepared for the long term impacts of what the brain injury what the brain injury would look like, how it would change, how it would continue to impact my family for years to come. Um, I'm not sure how the healthcare system could adapt to that because they were saying the whole time it was such a freak fluke thing that happened to my brother. They still don't know why it happened. So they had no way of knowing what was going to happen or how he was going to recover, what that recovery was going to look like. Um, I just in the moment when it was happening and for the first few months after that, I really saw it as something much more short term than it ended up being. Um, so I think that that's probably what I was least prepared for, I would say.
So the long-term impact is something that you were not prepared for. You were thinking more short-term.
Yeah, I think
Yeah.
also, sorry, just one more thing to add about the sibling perspective and being, a young sibling watching my brother go through this at the time. I don't think I was also prepared for, or I didn't really know how to handle all of this like newfound attention that I was getting in my community for having a brother who had gone through what he did. I remember the day after his stroke, I went to school and teachers who I didn't know were approaching me and, asking me if I was okay and not being invasive, but like it was like I was treated like, I don't know, like everyone was like walking on eggshells around me. Everyone in the community, one of my mom's friends set up a food service, so we had different families dropping off meals for us every day. And I'd have people at school being like, "Oh, my mom's making a meal for your mom later this week." And it'd be kids who I would like never speak to or who had like never spoken to me before. And it was just that was something that I wasn't really prepared for, and I didn't really know how to handle that. I remember talking to my school advisor several weeks out, and telling her to like stop, like get the other teachers to stop talking to me in the halls. Like I don't want to talk to these teachers who don't know me and who I don't know. The principal came up to me and like gave me a hug the day after, and I was like, I don't want to hug you. Like I it was a lot of attention, and I wasn't prepared for that as a sibling. And then also having to speak on behalf of my brother, because people were always asking, "Oh, how's he doing? Is he getting better? Is he?" The conversation was like always centered around him and his friends too, because his friends weren't really able to communicate with him. So they would always come up to me and ask me. And I was actually the one who had to tell all his friends what had happened to him the next day at school because no one knew and no one had heard from him. So yeah, I wasn't prepared for that as well.
Although that extra help, like preparing meals or getting meals, was well intended, is
Absolutely.
an
And
unfamiliar place for you.
I wouldn't change it for sure. Our community really, really held us for sure. And I'm grateful for all the support that we received. But at the time, I think, I was also like a self-absorbed teenager and I was like, leave me alone. Like, I don't want to, I felt like I needed more space. I just didn't really know what to do with all of this attention that I was getting or how to handle that in the moment.
You also made an interesting point, Madeline, that everybody was asking how your brother was. And I'm wondering what difference it would have made if people asked how you were and
Yeah.
not just your brother.
Yeah. I had one teacher who I was very close to, who was really just focused on me. And I think I really needed that at the time. And that was very, very helpful for me. I also had my figure skating coach was a massive support to me at the time because, he was also just focused on me. I remember like a month and a half after the stroke, he was like, "Oh, how's your brother?" And I was like, "Oh, that's so refreshing that it's been this long and it's not something that I have to talk about here, or something that I constantly have to report about or, yeah, just, yeah."
Yeah. So people need to ask, how's Madeline?
That's how I felt at the time. That's how I
Yeah.
felt at the time for sure.
Sure.
And also, sorry, I will say one last thing. Something that I wasn't prepared for as well. I guess something that I just didn't notice before. People make this comment all the time, like someone, shakes or drops something. You go, "Oh my gosh, I had a stroke." Happens all the time. And I didn't recognize this before, I had this personal experience with someone so close to me having a stroke. But I remember like a week after Aaron had his stroke, I was sitting in English class, and one kid in the class, like sitting across from me, was like acting as though he had had a stroke and like trying to make a joke about having strokes, not knowing, I guess, like what had happened to my brother. And maybe he did know. I don't really know, but I guess I wasn't prepared for like how that would feel. It wasn't something that I had experienced before. So yeah, that's something I wasn't prepared for as well.
Okay. Thanks so much, Madeline. Anne or Stacey, what were you least prepared for? And what could the healthcare system do differently to help prepare for that?
There were so many service providers involved with Stephen's life. And the coordination was incredible. And the paperwork and the phone calls and the emails and meeting and setting it up and making sure he was comfortable, and did he like the person, and would he agree? And there was so much. And he was really having a hard time with having to commit to meeting all these new people. He had no problem with taking the help, but it was exhausting to even think about booking an appointment. And because you're not working and you're home all the time, and you don't know when you're going to be awake, and you don't know when you're going to be sleeping, and you don't know when you're in pain. And he tried for maybe a year post the accident to really try to do it himself, but everybody would text me and call me and say he's not replying, he's not booking. So I ended up taking it all over. And in the last year, the biggest difference has been, first of all, a lot of these appointments are paid for through the car insurance because it was an auto accident. And it's a massive amount of paperwork to get a commitment from the insurance company to approve it. And Stephen would have to meet them. The OT would have to write the assessment, and we'd have to submit it and wait. And then that person might come and finally meet Stephen 2 or 3 months later, and he'll say, I don't like them. No, thanks. And meanwhile, it's been 3 months of work to get that person to the door, and then you had to start all over again. And that's been very difficult. And also, when he finally found someone he liked, and they might have an appointment booked, a friend of his will call and say, hey, do you want to go out today? He'd go, yeah. And he'd cancel that first appointment we've been waiting 4 months for. That's been really, really hard. And he's like, I don't care. I just like, I'm going to do what I want to do. And he appreciates all the help, and he appreciates all the service providers. But if he wakes up one day and he had a meeting and he doesn't want to do it, he's not doing it. And he doesn't, so maybe empathy's gone. I'm not sure.
So the influx of service providers you were not prepared for, and the volume of paperwork to complete all the forms and to get insurer approval, that was daunting from the sounds of it. Yeah.
Well, I was a former PSW, so I had a heads up. And I was a former admin assistant, so I was all in. Like when he had his accident, okay, again, reminding you, I wasn't allowed to go to the hospital, and I had weeks to wait for him to come home. I had my dining room table was full of files and faxes and paperwork, and it's all I did, and it kept me busy and it kept me distracted. So it was a good thing for me to have all these massive to-do lists, and I don't begrudge that at all because it seemed logical. But the amount of providers he's had over the last 2 years blows my mind. Yeah.
Thank you, Anne, for sharing that. Stacey, what would you like to add to that?
Yeah, what was I least prepared for? Initially, I'm going to say the phone call that Jake was in the collision. Never expected that. You never expected it's going to happen to your family. We had amazing support from the school and the community, which we're very thankful for. I wasn't prepared for the constant harassment from the media about Jake's collision. He was, he was in critical condition for some time, and I was not prepared for the media to not let not be able to leave our family alone. And, you know, we don't live in that small of a town, but it just seemed to be the highlight. And the driver that was driving the car that Jake was in was the driver that was at fault. And I wanted them to highlight that story as opposed to, you know, here's my boy who's the passenger who's fighting for his life. So I definitely wasn't prepared for that. The healthcare system was amazing. That being said, when it's motor vehicle related, I wasn't prepared. I did not know that I would have to notify my own motor vehicle insurance company that my boy was involved in an accident, even when he wasn't driving. And thankfully, we had the, additional accident benefits if there was a catastrophic injury. So I'm thankful for that. We had an amazing adjuster. I didn't realize how much I would have to work with the insurance company, and I agree with the paperwork. I have banker boxes full of paperwork with the OCF 18s from all the different therapists. Didn't realize the lack of speech pathologists that there is in the community that we live in. There isn't one that works privately. There is one at an acquired brain injury program, but because it's insurance related, Jacob doesn't qualify for those outreach programs. So our speech pathologist travels an hour and a half to 2 hours a day for Jake's speech sessions. And overall, the lack of therapists in our community that specifically work with brain injury. And when you're working through the insurance company, again, you don't qualify for the local brain injury program, which I think is something where both family and the entire family doesn't benefit from, because you're not able to be part of that local support group. And that's why I reached out to the Ontario Caregiver Organization and to OBIA to try to get support for myself, to help support my family and to help support Jake. We were part of an acquired brain injury program through Providence Care Hospital, and they did a family meeting before we left the hospital to kind of set us up for next steps moving forward for Jake, which I found to be very beneficial. And I feel that the connections that we made were in the hospital. I could call them back at any time or send an email back and continue to ask them for advice or if they had future suggestions. So I do feel that we do have the healthcare support, but you really have to be a strong advocate to get answers.
So thank you, Stacey. I'm hearing from all three of you that dealing with the system has been a challenge and new learning for all of you, whether it be dealing with healthcare systems that don't have specialized ABI supports or social supports in the community, family and friends who are stepping in to help. We're dealing with the medical insurance system and all its paperwork and all its forms. So it's a lot to navigate when people are already going through the most stressful time of their life. So thank you for sharing that and highlighting it.
Gla Rehab is a multidisciplinary team of clinicians and practitioners that provide assessment and treatment services for traumatic brain injuries, spinal cord injuries, orthopedic injuries, psychiatric problems, pediatrics, geriatrics, and chronic pain. The Gla Rehab team works with clients through each step of the recovery, employing a personal and effective strategy for rehabilitation from beginning to end. You can learn more about their work by visiting www.gla-rehab.com.
Did your loved one's injury impact your emotional, mental, or physical health? And if so, in what ways?
I guess I can speak to this one. I've always been a highly anxious person. And following my brother's injury, that was I definitely became more anxious, at least for a period of time. I think moving forward has just become another aspect of my anxiety. When I do deal with anxiety, oftentimes it is relating to situations related to my brother and my brother's circumstances and it used to be more like, is my brother going to be okay? I feel like that anxiety has stabilized since it's been considerable time, and he has been on a trajectory where he has been getting better and making progress for some time now. But sometimes there are behavioral issues, or I'll have conflict with him that are a result of his brain injury, and that'll cause me quite a bit of anxiety, and that'll be hard to work through. But yeah, it's something I've always dealt with. So it's not something that, was born out of the brain injury, but it's something that, has definitely grown with the brain injury.
Mm-hmm. Okay,
My physical health, I don't think was impacted too much. I didn't sleep well for like several weeks after he was sick. I don't eat when I'm stressed. So I didn't eat for a really long time. I lost a lot of weight. But that was all short term.
Thanks, Madeline. It's understandable that, if one was predisposed to anxiety before, that it would be exacerbated after the injury. Hey, Anne?
I think emotional, other people would have to answer that. It's really hard for me to judge that. I was in such chaos. I just wasn't dealing with a brain injury. So I was fortunate that I was sleeping and, shutting down that central nervous system and taking deep breaths is extremely important during a trauma. And this was a very long trauma. Physically, I found I was thrown into a massive PSW role in caregiving nursing. Like, it was physically demanding, but that's not because of a brain injury. Mentally, I have the Calm app, which is amazing. I love that. And I had yoga practice in the background. And I think the deep breathing seemed to be the best, and listening to music. And I'm going for massages because I really find my whole body is so massively tensed up all the time. And I'm in a lot of pain because I'm so anxious all the time about all the things I need to do. So that's really been helpful. I need to start taking care of me physically because I need to be well.
It's great to hear how you are using a variety of coping strategies to help manage stress and anxiety. So thanks for sharing that. That's great to hear, Anne. Stacey.
I think the impact of the injury has probably made me much more emotional. I'm okay unless somebody asks me how I am. So don't ask me how I am, because then you're going to get my emotions, unfortunately. It has made me realize what is really important in life. I've really grown as a person, as a mom, and as a caregiver since Jake's injury. Mentally, I think it's kind of taken me down the path towards some occupational interests. I've taken some courses through Obaya, through Brock University on neurorehabilitation. So it's kind of given me a new yearning to learn something new to help Jake. And physically, it's made me just be more aware of my self-care and my mindfulness, and taught myself how to ground myself and breathing techniques, that sort of thing. Because if I'm not good, then nobody's good. And if nobody's good, then that's not good for Jake. So I really need to try to do my best for him. The one area that it's probably impacted the most is my sleep. I don't sleep well, but I think that's just being a mom and full-time caregiver. So there's some positives to it, as much as everybody thinks that it's all negative. There are some real highlights and positives to things that we've learned through his injury.
Well, I'm really encouraged to hear the theme around self-care, because this is something that's for the long haul, and to keep one's coping and resilience enhanced, taking care of oneself, taking those breaks, the Calm app, the deep breathing, and trying to get some sleep. So good to hear that from all of you. How have communication dynamics changed within your family? And what did you have to learn to adapt to?
Sorry, Caron. I'm trying to construct an answer in my head that doesn't compromise my brother's privacy.
Sure. No, that's fair. Take your time with that.
Give me a second, maybe if someone else wants to answer first.
Yeah. Yeah, Anne, would you like to start us off? Yeah.
Sure. Yeah, give her some time. I think part of the issue is if anyone's on medication, of course, and you've got a brain injury and your Scott's thoughts are scattered, things are misfiring. And that makes it very difficult. I find with my husband's accident, he's overwhelmed completely by questions. He is concentrating so hard at trying to recover and manage pain and have some resemblance of a life. I find when I ask him a question, he's begging me not to. He doesn't want to be overwhelmed, and he's doing all he can to be stable. And he can't handle it. So communication has been very limited. I listen and I only ask him a question if I absolutely have to, and I have to really prioritize what the question is.
Thanks, Anne. And the effects of a brain injury can complicate communication, cognitive communication, and processing information. So it's really understandable, Anne, how you've described what your husband's dealing with.
Oh, and the other thing massively is since his accident and the brain injury, his short-term memory loss is quite severe. His long-term memory is fantastic, but short-term, no. He'll say, I gave him this medication. 5 minutes later, do I take it?
I can speak now. And as I was hearing you talk about your partner, your husband being overwhelmed easily, I definitely relate to that in my experience with my brother. Especially at first, he was easily overwhelmed, like all the time. He still experiences sensory overload to some degree, for sure. At the time, I remember it being challenging to, once he was able to start doing things again, it was challenging to go and do those things with him. Like in public, I remember going to a restaurant with him for the first time, and it was just like way too much sensory overload. We had to leave. So, that changed the dynamics of our communication at that time, making sure that he wasn't overwhelmed kind of like changed, the situations we put ourselves in as a family. I think also he's very angry about what's happened to him, as are all of us, but him in particular, and rightfully so. I would be super angry too if I was a perfectly healthy 14-year-old boy, very active, played a ton of sports, top-notch grades, and then has to deal with this, right, and come out the other end. And he has come out the other end. He really, really has, and he's made substantial progress, and that's been really excellent and rewarding for him, and also just for me to watch. But he still is quite angry, and so there are things that you just don't say in front of him, and just because it wouldn't be useful. Like if I'm complaining about something that something in my life that sometimes he's very empathetic, but other times, if he's feeling particularly angry about his disability, he can't be empathetic in that way, which I completely understand. I wouldn't be empathetic either, I'm sure. So I suppose that's kind of like changed the dynamic of our communication as well.
Okay. Thank you, Madeline. Stacey, what would you like to add?
Yeah, it's definitely changed our communication within our entire family, probably mostly between brothers. So, with Jake's injury, it's frontal lobe, so it's the sequencing, the processing, his lack of empathy, and hard at times, I think, for his older brother to understand, and the fact that it's a completely invisible injury. To look at Jake, he looks great, and he is great. Sorry, he doesn't just look great; he is great. But for others to see that there is that he does have cognitive challenges. He has mood challenges. He has neurofatigue. There can be at times third speech. They told us that he would never walk again, and he's doing physio now as tolerated. And, how his daily, he's had to learn how to do everything again. He's had to learn how to do every single thing over again. And, being a healthy 16-year-old and now being, he's 20, and knowing that he's had to learn how to do everything again, the communication has been a challenge. But we've worked through it, and we take one day at a time. And I remember the hospital, and one of the doctors, and he was phenomenal, told us that this was a marathon, not a sprint. And I go back to that quite often, and that gives me strength to know that we're in for the long haul, and we're training and doing what we need to do daily to get to a positive outcome.
And I think that's a great segue to our next question around how did roles and responsibilities change within your family? Madeline?
Yeah, speaking from my own experience, I was always the oldest sibling. So I was always, kind of in a little bit more of a caretaker role than my other two siblings. But following my brother's stroke, there certainly was, I did feel as though I had more responsibility, not because my parents were expecting more of me. They were very, hyper aware of, what was happening and the impact that would have on me, but just because of circumstances, right? There were, several nights, my parents would alternate nights at the hospital. And my sister was like 9. And so I was, often left with like one parent who would be at the hospital late or wasn't present, and it would just be me and my sister. And I would be taking care of her. So that was something that, changed in terms of our family dynamic. That's the first thing that comes to mind in terms of roles and responsibilities. We spent, I would argue, more time together as a family, following my brother's brain injury, which, as you were saying, Stacey, people talk about it like it's only bad things, but there were some positive moments as well. And in terms of roles and responsibilities, I guess, I don't know, our role like as a family together and our responsibility to each other was strengthened, because we would always just want to be around each other and want to be around my brother.
It's wonderful to hear about the growth and the positive changes that are happening in people's families in spite of the brain injury. So that's encouraging. Anne?
Well, I guess the biggest change is we bought this property where we live rural, and we are massive gardeners, landscapers, koi ponds, vegetable gardens. It's a lot out there. And, I always thought that we would be doing that together, and he is having a hard time with that. And he's not able to work ever again. So, we used to love just spending our weekends or days off together, doing that spending our quality time together, doing what we both loved. And that isn't happening anymore. That's a big change. And also for my daughter, who's massively involved with caregiving and happy to share and assist. And I must say that Stephen's her stepfather, so it's not her father. And it's a pretty big deal that a stepdaughter is so involved and so caring and so passionate, but it's a lot of responsibility that she's taken on. So that's been a massive change in her life.
So we've heard this afternoon how siblings have to step up to the plate, as well as sons and daughters, to accommodate some of the changes going on in the family system. So everyone is affected. Stacey?
I think the only thing that I can add is that it's just, my role of mom is still there, but then I also have the caregiver role. I kind of have the case management role. I have the advocacy role for, advocating for the invisible brain injury. And then I just lost my words. I'm sorry. But, and you know, it's not 24/7. I don't have to worry about Jake overnight. I mean, I'm here with him overnight, but I don't have to worry about when he's sleeping or anything like that, but it's been pretty constant. And, yeah, it's made me, sorry, I'm lost for words here. It's made me really appreciate, what I'm grateful for in my life and how blessed we are that we still have the new improved Jake with us. And that's what I say. Sometimes I get frustrated and then I go back to, we created a gratitude jar, and so that we write down the things that we're thankful for or the best parts of our day, and just to take it back to the basics, and to not get overwhelmed with thinking too far ahead of how much this injury potentially could be. I don't know if that made sense. Sorry.
No, it's wonderful to hear how you are focusing on gratitudes and the new and improved Jake, and the things that have improved in spite of what's happened. And I think this is a great lead-in into the next question. Drawing on your lived experiences, what would you recommend to others to help prevent burnout and stress and enhance coping and resilience? And I've heard some of you talk earlier about practicing the self-care, the calm apps, the deep breathing, the relaxation strategies. Other ideas that you have to recommend?
Something that comes to mind for me, and this may be more specific to two siblings, because I know my mom, for the first several months following my brother's brain injury, both my parents were, that was really all they were doing and all they were able to think about. As a sibling, it was most of what I was thinking about, but I did try to get away in some sense. And for me, that was figure skating. I would go skating multiple times a week, and I purposely didn't tell anyone at skating about what had happened for like several weeks, aside from my coach, because I just didn't want to think about it while I was there. And I wanted to have something that was separate, a place where I could escape. That was very helpful. I would argue that was the most helpful. In terms of, maintaining or managing my anxiety at that time, as both Stacey and Anne have suggested, mindfulness practices work very, very well. I did participate in some of those. And taking therapy seriously, we were required to do family therapy with Hall and Bloorview following my brother's brain injury, and I learned a lot from that, and that was very, very useful as well. So I guess advice I would give to other siblings going through something similar to what my family went through is finding an escape outlet, and using the resources you have available to you to practice mindfulness and well-being.
Great ideas, Madeline. Thank you.
Wow, Madeline, you're amazing. You've done so well for your age. It's incredible.
Thank you so much, Anne.
Wow. I'd say maybe about a year post-accident, I started doing psychotherapy because I was getting tired of talking to my family or friends. And I think that was really important because I don't want that to be all that I ever talk about with my family and friends. And I wanted to kind of close that door a little bit. That was very helpful. And I also didn't talk about my husband's brain injury at my work. So when I would go to work, people say, oh, how is he post-accident, blah, blah, blah. But I never got into what it was really like. So I just wanted to go to work and enjoy my time and not think about it and have a break once all the PSWs were here and he was comfortable and sorted out. And also now 2 years later, I would say that if someone wants to talk to me and I don't feel like it, I don't want to. I just send a text message and I say, I'm not feeling it today, but I'll touch base with you later. And that was a hard thing for me to do, but I'm doing that now.
So you really learned to establish boundaries around when you talk about your husband's injury, who you talk to about it. And if you don't, and if you need to take a break from talking about it at all, you do so. So really helpful tips.
Yeah, thank you.
Stacey, what would you like to recommend to others?
I agree with what Madeline and Anne have said for sure. Boundaries are very important. They're very hard to set, but I've started setting boundaries as well, just to express the importance of the routine and your diet and to exercise, not to lose things that you yourself enjoyed. Like Madeline said, you need to have an outlet. And initially that's hard. We're 3.5 years post collision, post injury, and I'm just starting to reach out and do some things for myself, and it feels really good. It's a sense of giving yourself a little bit of power. And if somebody offers help, don't say no. They may not offer the help in a way that you need it, but maybe you can turn it around to a way that something that can help you in your weekly situation. And I'm thankful for Obaya and the scale program that they did through the Ontario Caregiver Organization. That was, when it talked about the different phases of caregiver and the different emotions and stressors and the importance of self-compassion, self-care, and all the resources that are out there to help you have that for yourself.
And it sounds to you like you're doing a great job practicing all of that and putting it into practice, Stacey.
Trying.
Yeah. Madeline, I see your hand up.
Sorry, as the two of you were speaking, something else came to mind that I wanted to bring up, because I wish someone would have told me this earlier on in the game. And that is that, going through having a loved one who's gone through a brain injury, it really is a lived experience thing. And people who haven't lived it or haven't lived your specific experience can't understand to often the degree that you want them to. And that's been hard for me as, I made a ton of friends at university. I've had a few boyfriends since then. And it's, explaining to, these new people in my life who are very important to me, what my family has been through, to people who, weren't around when it was actually happening and have never had to go through anything like this before. So I guess what I would say is that, some people may not understand. Most people will not understand what you have been through as a family, and that is okay. Doesn't mean you can't have a relationship with that person.
Yeah, that's a very insightful comment, Madeline. Thank you for sharing that. Yeah. And I think your point about, reaching out to people who understand your lived experience is so important. And that's why podcasts such as this or Obaya can really make a difference to reduce that isolation for caregivers. We're wrapping up with our final question. If you could offer hope or advice to someone whose loved one has a brain injury, what would you tell them?
First of all, thank you for Obaya I was part of the spouses of brain injured for 2 whole sessions, and that was really good for me. And I really enjoyed that, and I would recommend that if someone was interested. Hope. I have to say the biggest assistance I had in the last 2 years was his occupational therapist. I was very fortunate. We were very fortunate to have this amazing woman. And she's been with us every 2 weeks for the last 2 years. And she's done every report, both CFATs. And she's got so many different people involved in my husband's life that she knew would suit his issues. So, if you're not happy with someone that is a service provider, find someone you like, because they're going to be with you for a long time. Yeah.
Thank you, Anne.
I just jotted down a few things quickly. What I would recommend to someone going through this, practicing gratitude, I think is a huge one. Stacey, you touched on that earlier. In addition to having strong communication with your community, what you need from them, and what you don't. My mom needed people to make us food every day from September until like the following February. And she communicated that to, the community, and they were able to set something up right at my brother's school and just like within our neighborhood. Those are 2 things I would recommend. I feel very fortunate that my brother has come as far as he had. Not to say that he doesn't still experience hardships that I never will. But I think all of us, I suppose, have developed a newfound sense of gratitude, appreciation, and also just strength for having gone through this and having to have gone through it together as a family. We're definitely stronger. And it's not to say that it still isn't hard sometimes, but I think we're closer because of it. So hopefully that provides some hope and comfort to someone listening to this.
That's a great way of synopsizing that, Madeline. Really inspiring. And Stacey.
I want to say that I'm thankful for the support groups through Abaya with severe traumatic brain injury. It's been, to share with strangers who understand where, maybe your best friend or your mom or your brother don't really understand because they haven't gone through, they're not living in that situation. I agree with if there's no connection with the support team for the therapies, that you need to find that connection because they really are the people that have the knowledge and the ability to help that injury move forward and to grow and for neuroplasticity to take place and everything to rewire. Never to give up hope. It's the brain's an amazing organ that, you just need time and patience. And we never thought that Jake would be where he is today. And he's our hero. He is dedicated to his therapies. He's dedicated to his recovery. He's starting to understand, the importance of his therapies and that's going to help him recover so that, he can move forward in his life. He's young. He's very resilient. He's very determined. And it's given our family strength that we can get through any battle. We had early in the hospital, a lady said to me, well, if this was going to happen to anybody, it's, I'm glad that it's happened to you. And I was kind of taken when she said that. And then I kind of thought about it later and I thought, my grandma always said to me, God doesn't give you what you can't handle. It's just going to make you stronger. And we have the support and the connections to get Jake through this recovery. And what she said to me now makes sense because it was very chaotic and, life altering. But here we are, we're moving forward and we're making progress and we've had very few setbacks. And I am we're truly blessed to be where we are. So I'm thankful for our healthcare system and our support groups and for Lauren and everybody at Abaya. So thank you very much.
That was so beautifully said, Stacey, and what a wonderful way of ending our podcast. I'm just so inspired by these messages of hope and gratitude and strength and resilience, and how all of you have grown and continue to grow with your families through your lived expertise and experiences. So thank you so much for sharing your stories, your experiences with us. And I know other caregivers and service providers out there will really benefit immensely from your conversations. Now, just to sum it up, I want to thank you all for taking your time to share your poignant stories, and I'm really grateful to all of you. The next podcast will be a discussion of recovering at home following a brain injury. So stay tuned for that one. And thank you for joining us, everyone. Thank you.